Well, here we are again, once again. Look at us. 1 week before Veterans Day, we are surrounded by really an unprecedented group of veteran service organizations and veterans who are affected by this toxic exposure issue. We think it's a good day, man. We're having good meetings. We think there is momentum. We think there is a willingness to do what's right to get these veterans the urgent health care and benefits that they've earned from their service. And we're hoping to power through what is a really smooth Washington process. I think we've always found it that way. They always want to do the right thing, and they always do it in a timely fashion. And this group is just here today to congratulate them on how well they have. It's only been 20 years. So, I'll let these guys go, because what I would really love today is for you to hear from some of these veterans who have come down here to tell their stories, to get this done in a timely fashion. It's Veterans Day on November 11th, and boy, what a lovely day to not just do a symbolic nod to the sacrifices that the men and women who serve this country have made, but to do something tangible to finally address the consequences that they face from their service. 20 years of war has a cost. This is it.
Yes, it is. Well said, John.
America. I'm speaking to the American people right now. I need you. They need you. We need you to contact your congressmen and your senators and demand, don't ask, don't beg, because we don't ask and we don't beg. They work for us. They work for us. Demand that these veterans who are sick and dying get the help that they deserve. A 20-year war with no pay for, and now they want to pay for to help people with cancer. The insult. These people deserve better. These men and women who protected us from harm's way. They're literally dying every day because they get denied and then they commit suicide. But yet we'll go up to them and say, hey, thank you for your service. That's bullshit. It should be thank you for your service. Thank you for your sacrifice. What can I do now to ease your pain? Perhaps I can help you get legislation passed. What a concept, Senate. Disgusting, repulsive, and I'm in the mood for a fight.
I'm with you. And we will stand with you, John. Thank you to John Field for his dedication, his determination. Thank you to Jon Stewart for his vision, for his leadership. And thank you to the extraordinary advocates and service members standing with us, Burn Pits 360, Disabled American Veterans, Iraq and Afghanistan Veterans of America, Reserve Organization of America, Veterans of Foreign Wars, Wounded Warrior Project, and everyone else who is standing here with us. They are walking the halls of Congress to demand justice, to demand what is rightfully theirs, the benefits that they have earned by sacrificing everything for this country. As we look ahead at Veterans Day, I ask my colleagues to recommit themselves once again to honoring the sacrifices of the men and women who commit their lives to defend this country. We send these brave service members into duty, onto the front lines of the war on terror all across the globe. They expose themselves to the most dangerous conditions known to this world. We ask them to live in places around the world where burn pits were used to destroy everything from electronics to clothing to building materials to human waste, and they breathed in those toxins all day long, all night long, a toxic sludge of carcinogens. Now they are sick, dying. Many have already passed. God rest their souls. We have a responsibility, we have an obligation to them, to their families. To deny them the care that they need today is a dereliction of our duty as Americans. But when these veterans and service members go to the VA to ask for the care that they need, they are denied that care 8 out of 10 times. They're told, where's the evidence? Prove it. Prove you were exposed. Prove there was a burn pit there. Are you kidding me? It's a disgrace. When you go to war, physically fit, top of your game, perfect in every way, you get exposed to toxic chemicals there. You are now suffering with thyroid cancer, other cancers. The connection is clear. No one should have to spend years jumping through hoops just to prove that the cancer was caused by some material burned in that burn pit so far away. No one should have to be proving the case of causation. The causation is clear. They shouldn't have to do their own research. They shouldn't have to pay for biopsies. They shouldn't have to prove to the VA that their illness is service-connected. And no one who is grieving a spouse lost to these diseases should have to fight the VA to get the benefits that the family is owed. But they are. Time and time again, we must change that. The longer we wait for more studies to prove causation that we already know, the more veterans will suffer and die without the support and health care that they and their families need. The VA estimates that 3.5 million people were exposed to burn pits, and already more than 270,000 veterans and service members have already added themselves to the burn pits registry. This is a healthcare crisis in the making. It's already started, and it is only going to get bigger. We need to act now to help those who are already sick and build the program that will ensure that those who get sick in the future don't have to continue to do battle when they get home with their own VA. The way we do this is by providing presumptive coverage. That means you create a system that says if you are there and you are sick, you are covered. That's what our bill says. That's what we are here to do. This is the cost of war. We're now going to hear directly from our service members.
Hi, I'm Jen Birch, the Senior Military Fellow with Iraq, Afghanistan Veterans of America. I served in Afghanistan from 2010 to 2011, exposed to burn pits, incinerators, and also in Afghanistan there's very fine dust, so you're breathing all those particles in. I came home as an avid runner. I left as an avid runner and came home and I could barely run a mile, suffering and coughing, and after a few years they found lung nodules and asthma and couldn't just name one thing but several. However, when I medically retired out of the Air Force, they denied that benefit. 7 years later, this year, I finally got the benefits I needed, but I had to pay out of pocket to get the research done, to go to these doctor's appointments. I had to do my own work to prove that that was a service-connected disability. I'm here today because I'm passionate in wanting to use my story to help other veterans to make sure their benefits are getting approved, because right now 80% of benefits that are filed for veterans are being denied. Thank you.
Hello, my name is Chad Bear. I'm an Army veteran, and I served overseas in the Horn of Africa. I lived and worked in an area where trash was being burned, and my eyes and lungs would burn all night. And I came home, I had asthma, and they found nodules in my lungs. I underwent a lot of tests, and I started reading the research on the issue. And I found it to be lacking, to say the least. So I got involved with all of these VSOs here, and it's brought me here today. And it's incredible because we have all of the largest VSOs. We've got veterans who are very sick here, and we hear well, what can we do to help the veterans? We need to see this is an issue. We have all of the largest organizations here walking the halls asking to pass this legislation. We've got so many that are sick or dying, and this keeps getting kicked down the road. And it seems to fall back to money, which is kind of unethical. We've got wounds of war, and science, which is kind of bunk science, because deep down those research papers, it says, well, we don't know what was burned, we don't know how much of what we don't know know for how long, we don't know who was exposed. So that will continue to be inconclusive until so many are sick and dying that it is conclusive, that it's statistically significant. So we know that what was done, the trash that was burned was carcinogenic. We know that that causes cancer. It would have been unlawful if that were done in the United States. So we're continuing to chase this, and I think I'm incredibly proud to be part of this group here today. All of these forces combined saying, pass this legislation. That's what we want. I'm just a veteran. I was an E4. I'm just a regular guy here. That's what we want. Thank you.
Can everybody hear me? So my name is Isaiah James. I'm Senior Policy Advisor for the Black Veterans Project. But I don't want to talk about myself. I was exposed to burn pits. I got 2 tours in Iraq, 1 tour in Afghanistan as a combat infantryman. But I want to talk about Private Mooney. I want to talk about Private Thomas. I want to talk about my brother, Sergeant Wesley Black. Sergeant Wesley Black's in his mid-30s like me. Sergeant Wesley Black was an infantryman like me. Sergeant Wesley Black deployed to Afghanistan like me. Yesterday, Sergeant Wesley Black told me he was going into hospice care. Sergeant Wesley Black has stage 4 colon cancer. Sergeant Wesley Black was denied the treatment at the VA that would have caught his cancer early and would have saved his life. Sergeant Wesley Black is not an aberration. Sergeant Wesley Black is millions of veterans across this nation that are denied health care and benefits from the very government that they were called to serve. And how serendipitous that we walk these halls and I see the American flag, but I also see the MIA POW flag. Prisoner of war, missing in action. America on this issue is missing in action. Our Congress on this issue is missing in action. The Fourth Estate, the media on this issue is absolutely missing in action. Veterans Day is coming up. We don't need your goddamn pancakes. We don't need half-off mattresses. We don't need to get in front at the movie theater line. What we need for you to do, America, the American public, the American legislative body, is to enact legislation that will take care of those who want in your name. We gave you our lives. We gave you our mental health. We gave you our very physical bodies. We laid it out for this nation. All we are asking for is not more. We're not asking for less. We're asking for equal. Give us what you promised us. Thank you.
Hi, my name is Kevin Hensley. I'm from Michigan. I spent 8 tours in the Middle East. 4 of those had operated open air burn pits. I have a terminal lung disease called constrictive bronchiolitis, and this is my new rifle. Thank you.
Hello, everyone. My name is Alex Morosky, and I'm with Wounded Warrior Project. And like others here today, I'm a post 9/11 veteran. I did 2 tours in Iraq. Situation we find ourselves in is that burn pits have become the Agent Orange of our generation. And we're having all the same problems and having our illnesses recognized as Vietnam veterans did when they came home. And the difference is, over the years, Congress has enacted a series of laws that creates a fair process for Vietnam veterans to access the health care and the benefits they deserve. They have a list of presumptive conditions, they have concession of exposure, they have a scientific framework, and they have guaranteed access to VA health care for life. This is what's been done for previous generations, and this is what we need too. No more, no less. In other words, if it's good for them, it's good for us. We believe these things are long overdue, and this is an urgent matter, and that's why we're here today to ask that this legislation be passed without delay. We all know what needs to happen. The time for waiting is over. The time to act is now. Thank you.
Thank you all for being here. My name is Christina Keenan, and I'm with the Veterans of Foreign Wars. And I want to thank everyone, Jon Stewart, John Field, the VSO partners here, Senator Gillibrand. Veterans with serious and sometimes life-threatening conditions due to their exposure to burn pits and other toxic and environmental exposures don't have time for VA to fix their system. While the VFW supports several toxic exposure bills, including the Senator's Warfighter Act, 6 months ago we asked Congress to put these bills together into a comprehensive solution on toxic exposure to help veterans of the past, present, and future. And they listened, which is why we're here today asking for support from Congress to provide the care and benefits which took Agent Orange exposed Vietnam veterans decades to achieve. Our current era veterans deserve no less. The time is now to fix the VA system, to take care of veterans suffering from respiratory conditions, cancers, and other conditions. These are injuries that were incurred during service. And as the legislation is aptly titled, this is a cost of war. Thank you so much.
Hi, thank you all for being here. Thank you for Senator Gillibrand having us here. I don't have a lot to say. I run the Washington, D.C. office for Iraq and Afghanistan, Veterans of America. I deployed to Afghanistan and a few other places. I consider myself lucky. I just came out with asthma. I take a pill every day, and my lungs keep working. But some of these other folks, they're not that lucky, and I'm here to speak for them. I heard the name of Wesley Black a few minutes ago. He's been with us here on the Hill before. He's done media, and now we don't see him here. It reminds me of when we're fighting for the 9/11 responders and how Ray Pfeiffer was on the Hill over and over and over again. And then when we did a press conference to say that we passed it, he wasn't there. So I'm here for all these folks. We need to pass this now. I testified before the Senate Veterans Affairs Committee a couple of weeks ago, and I remember that Chairman Tester said, I always remember it, he says, we just do what the veterans tell us to do. I mean, we're not asking for a lot. We're just sick and some are dying, and we need to fix this, and we need to get it done now. Thanks.
Hi, I'm Rosie Torres. I'm the co-founder of Burn Pits 360. I'm the wife of retired Captain Leroy Torres. We founded and came here to the Hill as families, grassroots effort, more than a decade ago. And I just, it's been an injustice that these families have faced. We've lost many, many along the way. We're honored to have Kevin here today and Isaiah and all these amazing veterans organizations behind us, with us, alongside us. And a special thank you to Jon Stewart and John Field. You know, they've been on the Hill for years. They could have said no. We're done. We've done 9/11, but they immediately said yes when they found out about the horrific injustice our war fighters and their families and their survivors were facing. Thank you to Senator Gillibrand, and we urge Congress to stand on the side of justice. There's a lack of accountability. We're tired of these contractors and no one being held liable, hiding behind the curtains of sovereign immunity. Something needs to be done now. Time is of essence. Thank you.
Well said.
You know, what you witnessed was courage under fire, grace under fire. These people have been neglected, lied to, kicked to the curb, denied, shit on, and yet they come up here and speak so eloquent. But I see one United States Senator who cares about the well-being of these men and women. If you're going to tell a story tonight, tell a story not about two Johns. Tell them about the people that we hear today that were advocating for tens of thousands, hundreds of thousands of their fellow soldiers who couldn't be here. Tell them about a small group of warriors that are trying to make a difference not only in their own lives, but in the lives of others. And we'll do 2 or 3 questions because we got to go to other meetings. Go ahead.
if you can't take care of the people that protect the country and take care of you, I think in some respects it's remedial. This is the lowest hanging fruit in a society. I mean, if we can't do this, what chance do the rest of us have? If we can't correct even the most basic of injustices to those who've served us, then I believe the phrase would be yikes. Well, the burn pits are, they've been outlawed. They're used occasionally, but the scandal is there's a really clear implementation of a solution that will take care of the really, we have to triage this. There's an urgent need amongst the medical population for diseases that are killing them, and then there's a protocol and a process in place to deal with it in the future. For some reason, toxic wounds are not considered wounds. We've developed excellence in traumatic brain injury, in prosthetics and adaptive rehabilitation. It just takes intention. It's within our capabilities, but it takes the intention. And I would really urge you all, and I truly appreciate you all coming out here today, but if you could talk to, when this is done, Isaiah and all the others that are here, and Rosie, and get their stories and tell them out, because I thought Isaiah said something really profound, which was, it's missing in action. There is no country that talks a better game for its veterans, but boy, are we letting them down in this circumstance. So if you could help them and have their stories break through this thing here, it would be incredible, and it would be much appreciated. So if you get an opportunity to do that. Yes, I'm sorry. Four other ways to dispose of waste. I mean, look, no one's saying that when you go to war, there aren't going to be contingencies, that you do things that you can't do. And I'm sure there's, I'm sure incinerators would be a slightly more, expensive way. And listen, whistleblowers at the Pentagon and whistleblowers in the field kept saying, we have the technology to do this a different way, but it was probably cheaper and more convenient to do it the way. But it is what it is. The job now is not to figure out why we did it. The job now is to clean up the consequences that they faced for that negligence. And that's the only thing that really matters at this point, is correcting it. Yes. I don't know if resistance is the right word. I honestly think there's a will to do it. I think there is a general, as maybe those of you who work down here might understand, bureaucratic malaise might be. It feels like, did you guys ever see the movie Brazil with Terry Gilliam? Fuck. Yeah.
We've been doing this together now for 12 years. And I've seen him come out of character twice. He never came out of character on the 9/11 bills, but he's come out of character twice on this bill. And that shows his empathy, his passion, and his commitment to these veterans. And while I am confident we are going to get a piece of legislation passed, we don't want to wait 17 years like we did for 9/11, 3 times. We want this done now. The Speaker of the House has the ability to put this bill on the floor. She promised us last week she would. It would then force the Senate to do something. It would then force a bunch of cranky old white people to get in a room and conference and reconcile. And then it will be up to those VSOs to say what they're willing to keep and what they're willing to lose. This can get done by the end of the year. Senate, Congress, you can multitask. You can chew gum and walk at the same time. It's okay. Anybody else?
So there's several bills that have been combined. Senator Tester has combined most of the working bills. There's a House version as well. They are to reform all of how the VA handles these kinds of diseases. I think that hopefully the House bill will go first because that's the more complete bill that has everything that we want. And hopefully Speaker Pelosi will put that on the floor, and then hopefully we will follow it in the Senate. And then just as John just said, we will conference the bills, and hopefully the most will stay in. The piece that I am responsible for is the burn pits piece, which is 100% comprehensive and all diseases are covered. We want as much of that in the final bill as possible because we want all diseases covered.
You know, call them out next week. Next week on Veterans Day. Just like on 9/11 when they did with us for years. How much they supported 9/11 responders. How much they support veterans. Thank you, all veterans. I salute you, veterans. Call them out on their bullshit. That's your job. You're the media. Say, why aren't you supporting burn pits? Why aren't you supporting these bills? Ask them. Have that conversation with them. Because they're all going to go to social media, and they're all going to tweet, they're all going to go on Facebook, Instagram, LinkedIn, whatever they do, and they're going to post crap. And actions speak a lot more than words.
Absolutely. Anything else? Did anyone else want to speak before we close out?
And I hope you guys start interviewing these young men and women.
Yeah, we just have a couple more people who want to say a few words. Thank you. Go ahead.
Good afternoon. I'm Shane with the Disabled American Veterans DAV. Really want to thank Senator Gillibrand and John for making this possible today. And here's the thing. Many of us have been fighting this since the first Persian Gulf in 1990, 1991. We're still fighting it today. There's an opportunity now. There are comprehensive pieces of legislation currently in the Senate and in the House. We just need action because Vietnam veterans are still waiting 50, 60 years for additional benefits. We don't need the current generation to wait that time either. So we have an opportunity. We need action, and we need it now. Thank you. Thank you, Senator.
Anyone else? Jeff, Connor?
How's everyone doing today? Good afternoon. Thanks for being here. My name's Jeff Phillips with the Reserve Organization of America. You know, I was in Desert Storm, Iraqi Freedom. I was briefly in Afghanistan. So that goes back, the veterans behind me, 20 plus years. Well, really, this is a century-old story that dates back to mustard gas in World War I. And veterans, the latest inheritors of this sad story, this disgrace, coming home and being stiff-armed by their government. It goes to the atomic veterans. It goes to those who suffered asbestos poisoning in the Cold War. Those of us who were affected by what's called Gulf War syndrome, and now the latest. This is for the executives in government to solve by presumption. The reason Congress is involved is because administration after administration after administration, read that, presidents of the United States, have failed to